You brush twice a day. You floss, you use mouthwash, you pop mints like they're going out of style, and your breath still smells. Here's the truth nobody in the dental aisle wants you to know. For 90% of people with chronic bad breath, the problem has absolutely nothing to do with your mouth. It's coming from somewhere much deeper, your gut. And until you fix what's happening down there, no amount of brushing, scraping, or gargling will ever give you truly fresh breath. Stay with me, because what I'm about to show you will completely change the way you think about halitosis forever. By the end of this video, you'll know the real cause, the real warning signs, and the exact step-by-step protocol to fix it for good. Let's start with the scale of this problem, because if you're dealing with chronic bad breath, you are far from alone. Approximately 25 to 30% of the global population suffers from chronic halitosis. That's nearly 2 billion people walking around every single day, anxious about their breath, avoiding close conversations, turning their heads when they speak. And most of them are being told the same useless advice. Brush more, floss better, try this new mouthwash. But here's the thing, there's a massive difference between transient bad breath and chronic halitosis. Transient bad breath is what happens after garlic bread, a strong coffee, or when you wake up in the morning. That's normal. That's expected. That goes away. Chronic halitosis is different. It persists no matter what you eat, no matter how many times you brush, no matter how much mouthwash you use. It comes back every single day. And studies show that people with chronic halitosis report significant anxiety in social and professional settings. They avoid leaning in for conversations. They stop laughing openly. Some develop patterns of self-isolation that affect their quality of life in profound ways. If that sounds familiar, if you've tried everything and nothing works, you are not failing at oral hygiene. You are being given bad information, and that ends today. So why does it keep coming back? The answer starts with understanding what bad breath actually is at a chemical level. Because here's something most people never think about. Bad breath isn't just a smell. It is a specific chemical event happening inside your body. The primary culprits are something called volatile sulfur compounds, VSCs for short. There are three main ones you need to know about. First, hydrogen sulfide, that's your classic rotten egg smell. Second, methyl mercaptan. This one has a distinctly fecal-like odor. And third, dimethyl sulfide, which smells almost like cabbage or decaying vegetables. These compounds are produced by anaerobic bacteria. Anaerobic means they thrive without oxygen. They love the dark, low-oxygen environments inside your mouth, your throat, and here's the critical part, your digestive tract. Now, most people assume these bacteria are just living on their teeth and tongue. And yes, some of them are. But here's the insight that changes everything. In chronic cases, VSCs are not just produced in the mouth. They are produced deep in the gut, absorbed into the bloodstream, carried to the lungs, and then exhaled with every single breath you take. This is called blood-borne halitosis, or systemic halitosis. The Journal of Breath Research has documented this pathway extensively, showing that the gut-to-lung-to-breath cycle is a real and measurable phenomenon in patients with chronic halitosis. So your mouth is broadcasting a message, but the message is originating somewhere else entirely. Now, and this is important, there are two specific gut conditions responsible for most chronic halitosis cases. I'll show you exactly how to test for both of them in a moment. But first, I need to make sure you understand the mechanism, because without that context, the solution won't make sense. Stay with me. Let me introduce you to the gut-oral axis. Think of it as a bidirectional microbial highway, a living, active communication channel between the bacteria in your mouth and the bacteria in your gut. What happens in your gut does not stay in your gut. It travels. It signals. It affects your breath, your skin, your brain, and your immune system. And nowhere is this more visible than in chronic halitosis. Let's talk about the first gut condition, H. pylori. Helicobacter pylori is a spiral-shaped bacterium that infects the stomach lining of approximately 44% of the global population, nearly half the world. And most people have absolutely no idea they carry it. NH2L. Pylori survives in the harsh acid environment of your stomach by producing an enzyme called urease. Urease breaks down urea, a natural compound in your body, into ammonia and carbon dioxide. That chemical reaction creates a distinctly foul, sharp, ammonia-like odor. And because this is happening inside your stomach, that odor finds its way out through your breath. Studies have shown that eradicating H. pylori significantly reduces halitosis scores in infected patients. Beyond bad breath, H. pylori also causes bloating, acid reflux, upper stomach pain, and nausea. If any of those symptoms sound familiar alongside your breath issues, pay close attention. Testing for H. pylori is straightforward. A urea breath test, a stool antigen test, or an endoscopy biopsy can all confirm infection. Now, let's talk about the second gut condition, SIBO, small intestinal bacterial overgrowth. Normally, your small intestine has relatively few bacteria. That's by design. Your small intestine is where most of your nutrient absorption happens, and a clean environment is critical for that process. But in SIBO, bacteria from elsewhere in the digestive tract migrate into the small intestine and proliferate. These bacteria start fermenting carbohydrates before your body can properly absorb them, producing massive amounts of hydrogen and methane gas in the process. Those gases enter your bloodstream, they travel to your lungs, and they come out of your mouth with every breath. SIBO symptoms include intense bloating after meals, especially after carbohydrates, alternating constipation and diarrhea, brain fog, fatigue, and yes, persistent bad breath that never seems to connect to what you eat. Testing for SIBO uses a lactulose or glucose breath test, which measures gas levels in your exhaled air after a controlled sugar challenge. Here is the key message I need you to hear right now. If your bad breath comes with any digestive symptoms, bloating, gas, reflux, irregular bowels, or that unexplained mental fog, there is a very strong chance that SIBO, or H. pylori, is at the root of it. And before I get into the solutions, I'm genuinely curious. Has anyone ever told you your bad breath might be connected to your gut before? Drop a yes or no in the comments right now. I read every single one. But here's where this gets more serious. Sometimes, bad breath isn't just about bacteria at all. I want to shift gears for a moment, and I want you to really listen to this part, because sometimes chronic bad breath is not a hygiene issue. It is not a gut bacteria issue. It is your body sending you a distress signal from a vital organ. And ignoring it or masking it with mints could mean missing something that genuinely matters for your long-term health. Let me walk you through 3 conditions where bad breath is a direct diagnostic warning sign. The first is liver disease and hepatic encephalopathy. When your liver is failing or severely compromised, it can no longer filter toxins efficiently. Dimethyl sulfide and other VSCs accumulate in the blood. They reach the lungs, and the breath takes on a very specific quality: sweet, musty, almost fecal. Clinicians have a name for it: fetor hepaticus. It's distinctive enough that trained physicians can recognize liver failure partly by smell alone. The second condition is chronic kidney disease and uremia. Failing kidneys cannot excrete urea efficiently. Urea builds up in the blood, and bacteria in the gut and mouth convert it to ammonia. The result is a distinctive, fishy, ammonia-like breath odor called uremic fetor. If your breath smells strongly of ammonia or fish, not garlic, not coffee, but genuinely ammonia, and you've never had kidney function tested, that is a conversation you need to have with your doctor. The third condition is uncontrolled diabetes and diabetic ketoacidosis, DKA. When the body cannot use glucose for energy and begins breaking down fat instead, a byproduct called acetone is produced and expelled through the lungs. The breath takes on a fruity or nail polish remover quality. In the context of DKA, this can be a medical emergency requiring immediate attention. I want to be very clear, I'm not here to scare you. The vast majority of people watching this have bad breath rooted in bacterial and gut microbiome issues, not organ failure. But if your bad breath has a very distinctive quality, fishy, ammonia-like, very sweet, or musty, and you have not had blood work or organ function tests done recently, please talk to your doctor. These are not cosmetic concerns. These are your body communicating something important. This is also why we never recommend just masking halitosis without investigating the root cause first. A mint is not a diagnosis. Let me give you a real-world example to bring all of this together. Let's call her Sarah. This is a representative case for educational purposes. Sarah was 34 years old. She'd been dealing with bad breath for 3 years. She'd seen 2 dentists. She'd had a professional deep clean. She switched to an electric toothbrush, used prescription-strength mouthwash, and even cut out coffee and garlic entirely. Nothing worked. What she noticed, but never connected, was that she also felt bloated after almost every meal and had a persistent mental fog she couldn't shake. When she finally got tested for SIBO using a lactulose breath test, the results came back positive. Once her SIBO was treated, combined with the oral probiotic protocol we're about to cover, her halitosis resolved within 8 weeks. Not 8 years. 8 weeks. That's what happens when you stop treating the symptom and start treating the source. So what does the actual fix look like? Let me walk you through the complete protocol from gut to mouth. We're about halfway through, and this next section is the most valuable part of the entire video. The protocol has 3 distinct layers, and this is critical. You need all 3 working together. Treating just one layer is why every single thing you've tried so far has given you only temporary results. Layer 1 is treating the gut root cause. If you have H. pylori, treatment requires a physician. The standard approach is triple therapy, 2 antibiotics, combined with a proton pump inhibitor, typically run for 14 days. It has a high eradication rate when completed fully. Natural adjuncts that have shown supporting evidence include mastic gum, which has been studied in the European Journal of Gastroenterology for its antimicrobial activity against H. pylori. Broccoli sprouts, specifically the compound sulforaphane, have also demonstrated H. pylori inhibiting properties in clinical research, and manuka honey has shown antibacterial activity in laboratory settings. These are adjuncts, not replacements. Always confirm with your physician first. For SIBO, the conventional medical treatment is rifaximin, an antibiotic that works locally in the gut without being significantly absorbed systemically, which is one reason it's preferred for intestinal overgrowth. For those seeking herbal alternatives, berberine, oregano oil, and allicin, derived from garlic, have emerging antimicrobial evidence, though the research is still developing. Do not self-diagnose or self-treat SIBO. Get the breath test. Let the results guide the protocol with a qualified provider. That's layer 1, the gut. Now layer 2, restoring the oral microbiome with targeted probiotics. I want to introduce you to what I consider the most important and most overlooked tool in the fight against chronic halitosis, Streptococcus salivarius K12. This is not a general probiotic. This is a strain that is naturally found in the mouths of people who have consistently fresh breath. Salivarius K12 produces compounds called lantibiotics, specifically bacteriocin-like inhibitory substances, or BLIS. These are natural antimicrobial peptides that directly suppress and outcompete VSC-producing bacteria. It doesn't carpet bomb your oral microbiome the way an antibiotic would. It strategically colonizes and crowds out the bacteria causing the odor. Multiple peer-reviewed studies show that Salivarius K 12 lozenges significantly reduce VSC levels and halitosis scores within 4 to 12 weeks of consistent use. The key word is consistent. How to use it. 1 lozenge dissolves slowly in the mouth at bedtime, after brushing. Do not eat or drink after. And importantly, if you've just finished a course of antibiotics for H. pylori or SIBO, wait at least 2 weeks before starting the K12 lozenge. Give the antibiotic time to clear. You'll find BLIS K12 lozenges from several reputable supplement brands. Always look for third-party testing and certificate of analysis. There's also a companion strain called Salivarius M18, which supports gum health and can be used alongside K12 for a more comprehensive oral microbiome approach. Now, layer 3, the mechanical protocol. This is the foundation that supports everything else. Tongue scraping. The dorsal surface of your tongue, the top of it, is the single largest reservoir of VSC-producing bacteria in your entire mouth. The grooves and fissures on your tongue create a perfect low-oxygen habitat for anaerobic bacteria to thrive and produce sulfur compounds. Studies show that proper tongue scraping can reduce VSC levels by up to 75% when done correctly and consistently. Here's the right way to do it. Use a copper or stainless steel tongue scraper, not a toothbrush, which just moves bacteria around rather than removing them. Start from as far back as is comfortable. Pull forward with gentle pressure, 3 to 5 strokes. Rinse between strokes. Do this first thing in the morning before you drink water, before you brush. You are removing a concentrated bacterial biofilm that has built up overnight. Now, about mouthwash. Most commercial alcohol-based mouthwashes are actually making your situation worse in the long run. The alcohol dries out your mouth. Saliva is your body's natural antibacterial defense. It contains enzymes, immunoglobulins, and maintains an oral pH that suppresses anaerobic bacteria. When saliva decreases, VSC production increases. Instead, consider a chlorine dioxide-based mouthwash like Closis, which targets VSCs directly, without the drying alcohol effect. And finally, hydration. Dry mouth, clinically called xerostomia, dramatically accelerates bad breath. Aim for a minimum of 2 liters of water per day. Hydrate between meals, not just with food. This keeps saliva flowing and VSC levels suppressed throughout the day. Let me pull all of that together into a simple daily routine you can start tomorrow. Here is exactly what your days should look like. In the morning, the very first thing you do is tongue scrape. Before water, before anything, 3 to 5 firm strokes from back to front. Then drink a full glass of water. Then brush your teeth. If you're using a chlorine dioxide mouthwash, use it after brushing. That's your morning. In the evening, brush thoroughly, then floss. Then let your salivarius K12 lozenge dissolve slowly in your mouth. Nothing to eat or drink after that. That's your evening. For ongoing gut support, if H. pylori or SIBO has been confirmed and treated, begin reintroducing fermented foods, gradually kefir, kimchi, sauerkraut, plain yogurt with live cultures. These support microbiome diversity during the recovery and rebalancing phase after treatment. Now, let's talk about realistic timelines, because expectations matter. With tongue scraping alone, most people notice a meaningful improvement within 1 to 2 weeks, with consistent salivarius K12 use. Measurable reduction in halitosis typically appears between 4 and 8 weeks. For H. pylori or SIBO treatment, full resolution of breath symptoms can take anywhere from 8 to 16 weeks, depending on severity and how well treatment is tolerated and completed. The key message I want you to anchor right here: this is not a single solution problem. That is why nothing you have tried alone has ever worked. You need to address all 3 layers simultaneously: the gut, the oral microbiome, the mechanical habits, all 3 working together. Now let's talk about when you absolutely need to see a doctor. Not because I want to alarm you, but because knowing these thresholds empowers you to advocate for yourself. Here are the specific situations that warrant a medical appointment. First, bad breath that persists despite 8 or more weeks of consistent daily oral hygiene protocol. That's the baseline. If you're doing everything right and it's still not improving, something deeper needs investigation. Second, bad breath with a very distinctive quality ammonia, fishy, intensely sweet or fruity, or musty, not just stale morning breath. We're talking unusual, persistent odors that don't match food intake. Third, bad breath, accompanied by digestive symptoms, chronic bloating, acid reflux, upper abdominal pain, irregular bowels, or unexplained fatigue and brain fog. Fourth, you have never been tested for H. pylori or SIBO, despite having chronic symptoms. These tests are widely available and relatively inexpensive. Ask for them by name. Fifth, you have risk factors for liver or kidney disease, heavy or regular alcohol consumption, type 2 diabetes, high blood pressure, or a family history of kidney or liver conditions. When you do see your doctor, here are the specific tests to request. For H. pylori, a urea breath test or stool antigen test. For SIBO, a lactulose breath test. For general organ health, a comprehensive metabolic panel, which checks liver enzymes and kidney function markers. And for diabetes screening, an HbA1c test. You now know more about the root causes of chronic bad breath than most people will ever be told in a standard medical appointment. Use this information. Ask these questions. Advocate for yourself. Before we wrap up, let me bust 3 persistent myths about bad breath fast. Myth number 1. More mouthwash equals fresher breath. False. Alcohol-based mouthwash reduces saliva production. Less saliva means more anaerobic bacterial activity. You are temporarily masking the odor while creating the exact conditions that make it worse. Myth number 2. Bad breath means bad oral hygiene. Also false. You can have a perfectly clean mouth, no cavities, no gum disease, immaculate teeth, and still have severe chronic halitosis if the root cause is in your gut. Oral hygiene is necessary. It is not sufficient on its own. Myth number 3. Mints and gum fix bad breath. Not even close. Mints are purely aromatic. They mask odor for 5 to 20 minutes. They do not touch VSC levels. And many of them contain sugar, which actively feeds the anaerobic bacteria producing the very smell you're trying to eliminate. You are literally feeding the problem. Let's lock in the 5 key takeaways from everything we've covered today. 1. Chronic bad breath is most commonly caused by VSC-producing anaerobic bacteria, and in chronic cases, those bacteria are often operating in your gut, not just your mouth. 2. Pylori and SIBO are 2 of the most underdiagnosed gut causes of halitosis in the world. Both are testable with simple breath and stool tests. Both are treatable. 3. Streptococcus salivarius K12 is the most evidence-backed oral probiotic for directly combating halitosis at the microbiome level. Use it nightly as a slow-dissolving lozenge. 4. Tongue scraping, proper mouthwash choice, and daily hydration form the essential mechanical foundation. Do these every single day without exception. 5. If your bad breath has an unusual quality ammonia, fishy, intensely sweet, or musty, or comes with systemic symptoms, get blood work done. Get organ function checked. It may be significantly more than a hygiene issue. At Mediment Health, we don't just treat symptoms, we go to the source. Because real health isn't about masking problems. It's about understanding them deeply enough to actually solve them. If this video gave you even one insight that could change your life or someone else's, please share it. Most people suffering from chronic bad breath have never been told any of this. They've been handed another bottle of mouthwash and sent home. You could be the reason someone finally gets real answers. Drop a comment below. Have you ever connected your bad breath to your gut before? Yes or no? I genuinely read every comment, and I would love to know if this shifted your perspective. And if you want more deep dives like this on the health topics your doctor doesn't have time to explain in a 10-minute appointment, subscribe to the channel. Hit the bell so you don't miss what's coming next week. Because next week, we are covering the silent gut condition that causes fatigue, brain fog, and unexplained weight gain in millions of people, and most of them have spent years thinking they're just stressed or getting older. You will not want to miss that one. This content is for educational purposes only. Please consult your doctor before making health changes.